Teresa, the rollout of this van is pretty good timing, being that it's National Respiratory Week. What's the main purpose of the van?
Well, Lung Check is actually a series of mobile lung units that we'll be rolling out here in Alberta. The primary focus is actually increasing access to patients in rural, remote, and Indigenous communities in Alberta, where access to pulmonary function testing or lung health testing is quite limited, actually.
Now, is this a pilot project, or will the van be on the road permanently visiting rural regions, including, like you mentioned, our First Nations communities?
Yeah, this is a 2 year proof of concept. It is our intention that if there is community demand and if there are, we know that there are service needs, if there are community demands and we are finding that this is making a great impact, it is our intention to sustain and continue to expand really the service offering for mobile lung health testing, I'll call it here in Alberta.
Now, apparently, there's no cost for someone to use the services of the van, right?
Yeah, there's no cost to Albertans. Really, you just need to speak with your family doctor to ask them to refer you to lung health check or the mobile lung units. So they can visit www.lunghealthcheck.ca. And our clinical team will coordinate with the patient and with the local primary care doctors to find a time where we can actually drive right into the community to increase access for those testing and to be able to see those patients.
Now, the van is for ages 5 and up, correct?
Correct.
Okay.
Yes.
Now, the Lung Health Check's new pulmonary function testing van is actually a collaboration with the province and some other partners. Who are they?
Yes, it's actually a very exciting partnership for the province. It's a public-private partnership. So the government of Alberta has been able to come to the table to be able to support this type of innovation. It's the first of its kind in Canada. We know that for your national audience, that other jurisdictions have already started to reach out to us to ask, how can we get this? How can we have a service like this in our rural communities as well? It also has private partners. AstraZeneca has allowed us with unrestricted funds to be able to go into the community and provide this innovative service, as well as our health service delivery partners at ASO Medical have partnered with our not-for-profit Praxis Health for many years now on actually increasing access using mobile service delivery to different communities. And so we're very excited about this public-private, even philanthropic partnership. We're inviting other partners to come to the table with us as well. So whether you're a community or you're even a large corporation that might be interested in being able to support this innovative work here in Alberta, we would welcome the opportunity. It's going to take many partners to continue to expand the services, but ensure that we get to those communities that are actually asking us to come around pulmonary function testing.
So, what are some of the biggest struggles that Canadians face right now when it comes to their lungs? Is it cystic fibrosis?
Yeah, it's asthma, it's COPD, it's pulmonary fibrosis, like you're saying. What we know is actually that 1 in 10 Canadians, by the time they're 40, will actually have COPD, and that 50% of those Canadians actually won't even be diagnosed. And oftentimes, those reasons are actually because of access challenges, like they don't have easy access to pulmonary lung testing in their community, or there's very long wait times. And so when we think about lung health, actually, it is very much affecting Albertans and is an area that we just need to be able to support increased access to monitoring as well as diagnosing close to home.
Teresa Tang, CEO and co-founder of Praxis Health, thanks so much for your time today.
Thank you so much.